um, 55% of my communication, to be quite frankly, is it's about verbal. And I think my tone is around 38%. And I think my body language is about 7% because most of what I'm doing is communicating, bending, pulling, straightening things out for the patient, sweeping, dusting, mopping. So I don't have time to give a negative body language, even if you want to try your best to. It's pretty difficult if you're going to do your job. Um,
I think that so much of what environmental services does inside of the patient room, in public spaces, in the emergency room, wherever we're cleaning and helping to take care of patients. So much of that is not so verbally articulated now. Most of it is a greeting or a salutation and explanation in a couple of moments on what we're going to be doing and perhaps the chemicals that we're using. But really, it starts with the knock and the good morning or the good afternoon or good evening. And then the body language really that environmental services is going to be using is all of what you just mentioned, Dion. And that is the cleaning and the cleaning tools and how we're going about our job and our function. So right. I think that if you were to say that sweeping, mopping, and pulling trash and soiled linen and doing the everyday task of cleaning and disinfecting surfaces and the minimal communication with the patient that we have, because time for environmental services is of the essence. We have only 10 minutes to make a big impact and always interaction. And I think that the body language in this case would be the task of actually doing the work and performing the cleaning. And the most important part of our verbal communication is the greeting and the introduction, and then followed, of course, by the way we exit the room or our salutation. So I think that we have an opportunity with the salutation.
So that is why I think that the verbal number should be a little bit higher. And now, even talking about body language and customer service and COVID, now we are wearing masks in these rooms, and we are greeting our guests with masks. How do we smile behind that mask so the patient can see us?
Well, again, from a patient perspective, I do understand that everybody has a responsibility, and I don't expect, environmental services to stand there and smile at me the entire time. But if we're speaking about communication, quote unquote, we have to admit that how you interact with the patient does play an important part. So they might be a percentage of these different categories of when we communicate, but to me, I'm not sure if I'm misinterpreting the question. What I'm interpreting is as an overall method of communicating is
yes.
Done with these percentages.
So this graph was created. I've been using this graph. In the beginning, I was taught that this graph was true. And the more and more I use this graph to teach, I have my students really think about it and wonder how much of it is, or in the room, how much of it, or in the corridors, how much of it play a part in customer service. So I don't know the right answer, but I know that the answer could be different from time to time. And that's my point towards communicating and educating anyone. I remember, we had a housekeeper many years ago in a patient room, and the patient didn't have legs and the housekeeper literally moved the tray table away from the patient, so the patient couldn't get their lunch. So that's another thing, and the housekeeper didn't say much. They just was totally inappropriate. Mm-hmm. Liz?
Well, I truly believe that we have to really take a look at all of our processes. We have to take a look at all our education, and we have to take a look at our team and bring people in and ask the housekeepers, what better folks to ask than the team members on the front line, and talk to them about the challenge that we're all going to have to rise to meet. And that is, how do we communicate with our patients with a mask on? So we know we have a very critical unit in one of our campuses, and it's the bone marrow unit. And on the bone marrow unit, part of your standard personal protective equipment, or PPE, before COVID, after COVID, during COVID, was a mask. Correct. So this unit did something so creative, and that was they took a picture of all the team members without a mask, and then they put the picture of the team member directly next to it with a mask on. So I think we might be seeing or suggesting more things like that pop up on units. So when patients walk around, they can take a look at that and maybe feel a little more at home and feel like they can see and meet and know who their caregivers are, housekeeping included. But I really think that it's going to be so important to sit and meet with our teams, not in large groups anymore, but maybe smaller clusters, practicing our new buzzword of social distancing, and just say to them, we need some guidance, we need some help, we need your ideas and your thoughts. How are you anticipating communicating with your patients, with perhaps the one or two visitors that might be coming in with the patient, and selling housekeeping and the services that we provide, and at the same time making sure that every interaction is respectful, and that every interaction with the patient hopefully gives them and makes them feel at home while they're in the hospital.
Very true. Very, very true.
I think if we turn to our frontline team members, they can really drive change and give us some really new provocative ideas that will make us really think about new ways to communicate with our patients. And I anticipate living with, in this new world, this new way of living, possibly for a while, with having COVID-19 patients, hopefully not, but maybe so, that you might have to add to your graph, to your chart, and might have to have a fourth way to communicate.
That's so true. And every day I wear a mask and go on the floor and enter a patient room to ask them, how are things going? I would love to know. I don't know, but I would love to know what's going through their minds. Who is this person without a mask, with the mask, coming into my room?
I think another concern that we all have to have and talk about is that we work and live in a very diverse city, and that a lot of people, we don't sound the same, we don't look the same, we don't do things the same way. And one of the things that I depend on is being able to watch somebody's lips move as they speak and as they pronounce certain words. And that enables me at times to understand people a little bit better. And I'm sure that people do the same thing when I'm speaking. And we also have hearing impaired, and we have people that possibly might be reading lips and are hard of hearing. So we have to think about all of these patients and some of our staff as well.
Yep. Yep.
Absolutely. Did you all ever think about doing a randomized study from the patient perspective to just compare and contrast the differences on how the patients may feel the most effective way to communicate might be versus how the staff might feel in communicating? Because I know, again, this is a changing world for everyone. And so now we're not just speaking with our mouths, even though we should not have done that previously. We should have been paying attention to tone and body language and vocals. And so one of the things that popped into my head when you all were talking and saying the mask, I kept visualizing superheroes like Spider-Man and Batman, and so many people who wear masks, and we can kind of distinguish good and bad behaviors from them because we pay attention to other context clues within a person. So maybe we might have to call it the superhero approach, where we're looking at our patients, and not even just our patients, but ourselves, where this mask is not something that is kind of preventing us from communicating, but looking for different ways to communicate. As we spoke of yesterday, we also have to remember that even though the lips are visible, and Liz touched base on it before, some people are ESL, English as a second language. So your lips moving may not produce the information that they need. It can be like a pointing, it can be a gesture, it can be a hand motion that, that directs them in the certain direction. Or we have been using things like kiosks. Maybe we can have electronic devices that we purchase where we can have patients that can be programmed to different languages, so we can communicate that way with the patients. We have to be much more creative when it comes to communication. And so I do understand that everybody has a job to do, but I do believe that outside of just vocals, we can express ourselves. For instance, if a cleaning crew walked into the room, and everything they say with their back turned to me, that will give me a perception as if they don't want to be bothered. They're not as engaged. So just some of these things, we can think of different ways to open up and provide more effective communication in the superhero.
But good point, especially the superhero piece.
And the back being turned. And these are some of the things, Dr. Carr, that I've never even thought about that. And many times when you mop, you might be turning, or perhaps could be turning your back to the patient. And as Dion was saying, I really love the superhero reference. It's so profound.
But even with the superhero piece, I wrote down here, behaviors have a lot of factors in it, because even Spider-Man and Superman and all of these superheroes, we know them as heroes because of their behaviors, not because of the mask.
Absolutely.
I didn't hear that.
I said absolutely.
Right. So, Spider-Man, for instance, saves people, consistently saving someone in a mask and a certain costume. So, I think that's a very good point. Even though a lot of what we do are very mechanical. So, and good point with the back being turned. If my back is turned, and even if I'm saying very good things and I'm not facing you, that's negative to me. You could be saying wonderful things and purposely turning your back at me. I don't see that as positive. I think that's a double negative, and the nice thing is a positive. So we end up in the negative.
Well, I think that we have to go back to our training videos, go back to all of our job aids that we correct for our team members, maybe have some sessions and get some ideas, incorporate some of